guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on diabetic foot. So what is diabetic foot? Let's discuss it. Diabetes is a disease in which your blood glucose or blood sugar levels are too high. Glucose comes from foods you eat. The cells of your body need glucose for energy. A hormone called insulin helps the glucose get into your cells. With type 1 diabetes, your body doesn't make insulin. With type 2 diabetes, your body doesn't make or use insulin well. Without enough insulin, glucose cannot get into your cells as quickly as usual. The glucose builds up in your blood and causes high blood sugar levels. How does diabetes cause foot problems? Foot problems are common in people with diabetes. They can happen over time when high blood sugar damages the nerves and blood vessels in the feet. The nerve damage is called diabetic neuropathy, can cause numbness, tingling, pain, or loss of feeling in your feet. If you cannot feel pain, you may not know when you have a cut, blister, or ulcer, open sore, or on your foot. A wound like that could get infected. The infection may not heal well because the damaged blood vessels can cause poor blood flow in your feet. Having an infection and poor blood flow can lead to gangrene. That means the muscle, skin, and other tissues start to die. If you have gangrene or a foot ulcer that does not get better with treatment, you may need an amputation. This is a surgery to cut off your damaged foot or part of your leg. It may prevent a bad infection from spreading and could save your life. But there's a lot you can do to prevent a foot wound from becoming a major health problem. How can I protect my foot if I have diabetes? The best way to protect your feet is by controlling your blood sugar levels every day. This will help keep nerves and blood vessels damaged from getting burst. The next step is to keep the skin of your feet healthy. Good foot care for people with diabetes include checking your feet every day. Checking your feet every day, look for cuts, redness, and other changes in the skin and toenails, including warts or other spots that your shoes could rub. Make sure to check the bottoms of your feet too. And washing your feet every day, use warm water and soap. Don't soak your foot because that can dry out your skin. After you dry your foot, you can use talcum powder or cornstarch between your toes. They soak up moisture that can cause infection. If you use lotion, don't apply it between your toes. Asking your doctor how to remove corns and calluses safely. Thick skin on your feet can rub and lead to sores, but removing in the wrong way could damage your skin, so you don't want to cut the skin or use medicated pads or liquid removers. Trimming your toenails straight across with a clipper. If it is hard for you to trim your own toenails, or if they are thick or curve into skin, have a podiatric foot doctor do it for you. Always wearing well-fitting shoes and socks or slippers to protect your feet when walking. You don't want to walk barefoot even indoors, and be sure your shoes are smooth inside. A seam or pebble would rub your skin raw. Protecting your feet from heat and cold. Use a sunscreen on exposed skin and don't walk barefoot at the beach. In cold weather, wear warm socks instead of warming your feet near a heater or fireplace. Keeping the blood flowing in your feet. Put your feet up when you are sitting. Wiggle your toes and circle your feet throughout the day. Don't wear tight socks and get plenty of activity that's not too hard on the feet, such as walking. Getting your feet checked at your healthcare visits, and even if you have noticed a problem, it's good to have your healthcare provider look at your feet. When should I see my healthcare provider about diabetic foot problems? Serious foot problems can develop quickly. See your healthcare provider right away. If you have noticed a cut, a blister, a bruise on your feet that doesn't start to heal in a few days, red, warm, or painful skin on your feet, a callus with dried blood inside, a foot infection that becomes black and smells bad, that could be gangrene. Remember, controlling your blood sugar and caring for your feet every day are the best step you can take to prevent serious diabetic foot problems. What are the diabetic foot complications? People with diabetes can develop many different foot problems. Even ordinary people can get worse and lead to serious complications. Foot problems most often happen when there is nerve damage, also called neuropathy. This can cause tingling, pain, burning, or stinging, or weakness in the foot. It can also cause loss of feeling in the foot, so you can injure it and not know it. Poor blood flow, changes in the shape of your foot or toes may also cause problems. Take good care of your feet and see your doctor right away if you have any signs of foot problems. When you have diabetes, caring for your feet is very important in avoiding serious foot complications. Take care of your feet by doing the following: wash your feet thoroughly every day, dry them thoroughly, and don't forget to dry between your toes. Moisture your foot but avoid moisturizing between your toes. Keep your toe nails trim and use an emery board to file down sharp edges. Check your feet for sores, cut, blisters, corns, or redness daily. Let your doctor know if you can find any of these. Wear moisture wicking socks before putting your shoes on. Check for sharp objects such as the small rocks. Wear shoes that fit well and don't rub your feet. While you are at it, avoid these. Don't walk around barefoot, don't soak your foot, and don't smoke. Although it can hurt, the neuropathy can hurt. Diabetic nerve damage can also lessen your ability to feel pain, heat, and cold. Loss of feeling often means you may not feel a foot injury. You could have a tack or a stone in your shoe or walk on it all the way without knowing, and you could get a blister and not feel it. You might not notice a foot injury until the skin breaks down and becomes infected. Nerve damage can also lead to change in the shape of your feet and toes. If your foot doesn't fit comfortably in regular shoes, ask your doctor about special therapeutic shoes or inserts rather than forcing your foot and toes into shoes that don't fit and cause more damage. Then there might be skin changes, such as diabetes can cause changes in the skin of your foot. At times your foot may become very dry, the skin may peel and crack. This problem is caused by nerve damage that affects your body's ability to control the oil and moisture in your foot. After bathing, dry your feet and seal in the remaining moisture within a thin coat of plain petroleum jelly, an unscented hand cream, or other such product. Do not put oils or creams between your toes. The extra moisture can lead to infection. Also, don't soak your feet, that can dry your skin. Then calluses occur more often and build up faster on the feet of the people with diabetes. This is because there are high pressure areas under the foot. Too much callus may mean that you will need therapeutic shoes and inserts. Calluses, if not trimmed, get very thick, break down, and turn into ulcers. Open sores. Never try to cut calluses or corns yourselves. This can lead to ulcers and infections. Let a healthcare professional on your diabetes care team cut your calluses. Also, do not try to remove calluses and corn with chemical agent. These products can burn your skin. Using a pumice stone every day will help keep calluses under control. It is best to use the pumice stone on wet skin. Put on lotion right after you use the pumice stone. Then the poor circulation or poor blood flow can make your foot less able to fight infection and to heal. Diabetes causes blood vessels of the foot and leg to narrow and harden. You can control some of the things that cause poor blood flow. Don't smoke. Smoking makes arteries harder faster. Also, follow your diabetes care team advice for keeping your blood pressure and cholesterol under control. If your feet are cold, you may want to warm them. Keep aware that unfortunately, if you have nerve damage, your feet may not be able to feel heat properly, and it is easy for you to burn them with hot water bottles or heating pad. The best way to warm cold feet is to wear warm socks. Some people feel pain in their calves when walking fast up a hill or on a hard surface. This condition is called intermittent claudication. Stopping to rest for a few moments should end the pain. If you have these symptoms, you must stop smoking. Work with your diabetes care team to get started on a walking program. Some people can also be helped with medication to improve the circulation Exercise is good for poor circulation. It stimulates the blood flow in the legs and feet. Walk in sturdy, comfortable shoes that fit comfortably, but don't walk when you have open sores on your foot. Then the foot ulcers most often occur on the ball of the foot or on the bottom of the big toe. Ulcers on the sides of the foot are usually due to poor fitting shoes. Remember, even though some ulcers do not hurt, even every ulcer should be seen by your doctor right away. Neglecting ulcers can result in infection, which in turn can lead to loss of a limb. What your doctor will do to varies with your ulcer. Your doctor may need to take x-rays of your foot to make sure the bone is not infected. The ulcer may not need to have any dead and infected tissue cleaned out. You may need to go into the hospital for this cleaning also. A culture of the wound may be used to find out what type of infection you have and which antibiotic will work best. Keeping off your feet is very important. Walking on a red ulcer can enlarge it and force the infection deeper into your foot. Your doctor may put a special shoe brace or cast on your foot to protect it. If your ulcer is not healing and your circulation is poor, you may be referred to a vascular surgeon. Managing diabetes is important since high blood glucose sugar levels make it hard to fight infection. After a foot ulcer heals, treat your foot carefully. Scar tissue from the wound will break down easily. You may need to wear special shoes after the ulcer is healed to protect this area and to prevent the ulcer from returning. Then in the last, we have people with diabetes are far more likely to have a foot or leg amputated than other people. The problem: many people with diabetes have peripheral arterial disease (PAD), which reduces blood flow to the feet. Also, many people with diabetes have neuropathy, causing you to not feel your feet. Together, these problems make it easy to get ulcers and infections that may lead to amputation. Most amputations are preventable by checking your feet daily. Go to the regular visits with your doctor and wear proper footwear. For these reasons, take good care of your feet and see your doctor right away if you see any signs of foot problem. Ask about prescription shoes that are covered by Medicare and other insurances. Always follow your doctor's advice when caring for ulcers or other foot problems. One of the biggest threats to your feet is smoking. Smoking affects small blood vessels, can cause decreased blood flow to the feet and make wounds heal slowly. A lot of people with diabetes who need amputations are smokers. So this was all about the diabetic foot. So I hope so that this discussion will be more informative for you and you would have enjoyed this video. If you have liked this video, then kindly share this video with other individuals as well, and don't forget to subscribe my channel. Thank you for watching this video and have a wonderful nice day.